There really truly is a difference between breast milk and formula. And it really does make a difference for babies and mothers in their long-term health. Babies who receive breast milk have a lower risk of respiratory and GI infections. They have a lower risk of asthma and obesity, and also actually SIDS, sudden infant death syndrome, is less in babies who are breastfed. It also gives lifelong protection, like I said, against things like asthma and obesity. It's also easier in the long term. Lots of times the early weeks might have some challenges, but we're going to talk about ways you can get help for that. But over the long term, it is easier than getting up in the middle of the night, fixing bottles, warming them up, preparing formula, all of those kinds of things. If you can just bring baby to the breast, feed them and be done, it is easier. Breast milk is easier to digest for babies. People may notice that sometimes their babies wake up a little bit more when they're breastfed than when they're given formula. Not always, although you may hear people say that. And that's actually because breast milk is harder to digest. It's not that it's more satisfying, it's that it's harder for babies to digest and takes longer. So breast milk is easier to digest than formula is. And also there are a lot of advantages to breastfeeding that women may not know, in that it's good for them as well as for the baby. It reduces their long-term health risks of high blood pressure, breast cancer, and ovarian cancer for the woman over her lifetime. And it also can reduce her risk of high blood pressure and also reduces postpartum depression. And many people are surprised by that. They feel like, well, mothers get more tired, they get more depressed. It actually will help with postpartum depression. So there are a lot of important things that are good in the long term with breastfeeding, not to force anybody to change their mind, but I know that community health workers, I have learned from Fua in my learnings from her, that CHWs are really about health prevention. And breastfeeding is really one of the earliest health prevention measures that we have. So that's one of our first main takeaways, is that breastfeeding really is different than formula, and it offers long-term health prevention benefits for families.